Okay, so our patient is in the room next door, and what we've done is we've gone ahead, and if you recall, we've lasered the tissue a little bit around that tooth so that we've started to create some of the emergence, some of the contours that we want subgingivally. Okay? We placed our impression coping on that implant, and we have taken the impression. So when we take it out of the mouth, this is what we have. We've captured what we need. We have the implant analog in place. The implant impression coping in place. All we need to do is take our implant analog, place it on top, just slightly screw it into position, okay, and then from this we can go ahead and into the dental laboratory, pour this with stone, and capture what we need. Now, just before we do that though, remember we have to create our soft tissue so that we can have our soft tissue model. And the way we're going to do that is we have a little Gingatech, a little Vaseline. Now it's important that we don't forget the Vaseline. With polyvinyl and the Gingatech, they're similar materials and they will stick to each other. So what we're going to do is express a little Vaseline. We're going to paint it gently around the base of the impression, also a little bit on the interproximal surfaces of the adjacent teeth, because we don't want that soft tissue model to stick to the impression material. We're then going to go ahead and take our Gingatech material, express a little out. And then it's not a matter of, expressing a lot here. You want to just put enough to create the soft tissue model and create and capture some of those that soft tissue so we can create the contours that we need. So we're going to squirt that around. Very good. And that will set on its own. A few minutes, make sure our analog is back in place. After this is set, go ahead and pour that in the stone model. Okay, so let's go pour it. We'll be back in a minute. Okay, so we're back. We've poured the impression. We've removed our impression from it, separated the two, and what we're left with is our implant impression coping sticking out of our model and a nice representation of the soft tissue. So this now will allow us to do the direct-indirect method of creating the provisional. So we're going to remove the implant coping, and this is what we have. Okay. Now at this stage, what we need to do is we're going to need to modify the soft tissue contour here to start to create the emergence that we need for the provisional. And the way we're going to do that is going to use a high-speed handpiece, and we're going to just start to contour around. Okay, so then we come to the benchtop, and with our large diamond, we're going to go ahead and start to shape the subgingival contour in the soft tissue model. And there's no rush in doing this. We can go ahead and just start to shape it. You want to start to thin out the area between the interproximal portion of the teeth and start to create the natural shape that a central incisor has. And if you recall, it's a little wider on the interproximal area, almost like a triangle shape. It's a little rounded or towards the facial gingival free margin. So I'm going to spend a little time shaping the soft tissue and widening it and getting it to the size that we want it to be. Okay? So I'm going to just keep doing a little bit at a time. Okay. All right, so let's take a look at that together. At this point, we've now brought the soft tissue over and reshaped the subgingival contour so that we can start creating our provisional. Okay? Now, with provisional and provisional abutments, we have a few different choices. One of the things I like about the Biomet 3i abutment and implant system is that they have a couple of different choices when it comes to provisional abutments. They have the preformance post, which is smooth along the base and bottom, and they have the one that's a little bit more gnarled. Now the situation is, for instance, if we think about a lateral incisor, something like this is actually pretty wide and would take a lot of contouring and reshaping just to start to create the lateral incisor shape or size. Now sometimes it's just fine and perfect. It's a matter of trying it on the model and deciding which one is going to work best for the situation at hand. I find myself sometimes using this one more for lateral incisors because of its size. But I'm going to try them both on the model and we'll see which one we like better. So let me first put the preformance post in. The other thing I like about the Biomet 3i implant system is that it has the snap that clicks position, so that I can click this to place and create my temporary or provisional on this without having to screw my temporary down, unscrewing it, screw it down, unscrew it all the time I'm trying to modify it. So looking at this in place, in regards to its contour, this actually fits pretty well the subgingival contour that I've created in the soft tissue model, so I might want to use this one and just modify it from here. But just to make sure, I'm going to go ahead and take the other one as well and place that one in and snap it to place. Once clicked in place, same thing. This would work very well as well. This one, as you can see, there's more space around the gingiva, between the gingiva and the performance temporary abutment. Now, based on what I see here, I'm going to go ahead and use the preformance post. I like the way the shape is. It fills in the space around the soft tissue a little better. I'm going to snap it to place. Okay. And once it's in place, we can go ahead and start to reshape the abutment. So as we discussed in the lecture, where do we start? Well, the first place we start is a person's lost their front tooth. We go ahead and create the wax up, and then from that wax up, create the surgical guide for the oral surgeon or the surgeon to place the implant. And for us, we go ahead and fabricate the provisional matrix so that we can make and fabricate the provisional. Okay? So at this point, we've gone ahead and seated now the provisional post on the model, and it's now time for us to go ahead and modify the abutment and start to create the contours on the provisional. So we're going to take the same large diamond. Now, it's up to you what burrs you prefer to use to modify this. You know, as most of you know, modifying these plastic abutments can be a little challenging, so I may change to different burrs depending upon how this works. We're going to go ahead and start. The first thing I want to do is start to think about creating my margin, where I want my margin to be, both gingivally and facially, and then I'm going to go ahead and from there we'll go ahead and wrap and start to prepare the tooth. So at this stage I've started to modify the facial and lingual margin. I'm going to now switch to a smaller diamond that I can create my shoulder and my normal crown and bridge preparation with. So what I want to keep in mind as I'm doing this is I want to envision the final shape of the provisional abutment and the final shape for the final crown abutment. Finish with the lingual preparation. I'm going to go do the facial preparation, keeping in mind of where the free gingival margin is and where we're going to want to add. Modify the height a little bit if we need to. Okay. So at this point, the provisional abutment starts to take form similar to what our final abutment and final contours will be. Good. So at this stage we've created some of the initial contours. Now it's time for the flow composite. And we're going to go ahead and flow the composite in and against the soft tissue material. I'm going to use a little Vaseline on the soft tissue just to make sure it's not going to stick. Okay. We're going to take our flow composite and start to flow it in that gap that we'd seen in the lecture portion, the gap that's still here between the provisional and soft tissue model. Okay. Once we've flowed it in and we feel comfortable that we've filled the gap, we're going to go ahead and light cure it. We're now going to remove the provisional abutment. And again, we can see that we've started to create some of that soft tissue profile and part of the abutment. So what we're going to do is we're going to take our flow composite again, and this time we're going to go ahead and flow it into the gaps and the space that along where the soft tissue is just not smooth. Going to do that all the way around. So that we can make a subtle change in the contour subgingivally. Going to light cure it. Good. Now we know that the provisional abutment is on the head of the implant, and that we have started to create our soft contours, and we know approximately where our free gingival margin is from our preparation. We're going to go ahead and take the handpiece again, and we're going to finalize and modify this. To create a little easier handle to do this, sometimes we go ahead and take an additional lab analog and we'll screw this down onto the lab analog so that it won't be moving around. It gives me a little extra handle to hold on to as we go ahead and start to prepare the subgingival portion of the abutment. We'll take our high speed. Starting to create the shape. Now it's difficult to add all of the flow composite all at one time, so again I'm going to initially shape, starting to take form subgingivally now. Going to add a little bit more flow composite into the gap, so that we can make a nice smooth transition. And light cure it. Okay. At this stage I'm going to change to a polisher to finish my contour. Something a little less abrasive. I'm getting close to finishing the subgingival contour. Good. Now that's finished. Finished with the subgingival contour. We're going to go back and finalize the area of our free gingival margin, giving ourselves a nice chamfer or shoulder, whichever type of preparation you prefer. Now initially when we prepared this on the soft tissue model, it gave us a guide as to where the margin needs to be. Now it's just a matter of refining it and smoothing it. Very good. So now we've created the abutment. We have most of the subgingival contour has been created. We know where our margin's supposed to be. We're going to go ahead and put it back on our soft tissue model. Just sort of verify its position. Usually you can tell by the shape that you've had to create when you prepared the abutment as to which is the facial and which is the gingival. Screw it back to place. And now we're going to go ahead and just make sure that the final placement of our margin is where we want it to be. So we're going to just do the last little bit, creating our final margin on the provisional abutment. Take a look. Everything looks good. About a ½ millimeter subgingival to the free gingival margin. We have good support interproximally, and we have a nice sort of semi-triangular shape. And the abutment looks great. At this stage, we're ready to go ahead and make the remaining tooth provisional for the crown. And we're going to do that. We're going to go ahead and take a little cotton pellet. We're going to fill in our access, screw access hole. A little cotton. Okay. Again, we're going to put a little Vaseline on the abutment. And on the adjacent teeth. Okay. We're going to take our matrix that we created from our diagnostic wax-up. Take our Luxitemp material. Fill our matrix. Now it's just like making any other standard provisional at this point. Put our matrix on our model. Let it set for 2.5 minutes. So we allow this to set. Go ahead and remove our matrix. And sure enough, we have ourselves a provisional. We're going to go ahead and remove the provisional from the model and the abutment. I'm going to go ahead and shape the contour on the provisional. Now we know where the soft tissue ends and the abutment begins. We've captured the margin really just as if it's a natural tooth. What I'm going to do, though, I am going to flow a little additional composite around the margin in some of the little gap areas, because we do want a nice emergence from the soft tissue with no gap, so it can help continue to guide that tissue in approximately and support the papilla. Like here. Okay. Finish shaping the margin on the provisional. Okay. At this stage we have our provisional. We have our provisional abutment. Normally we go ahead and take a little glaze. We glaze with Palaseal so that we can create a nice shine to the provisional, like here. At this stage our provisional is complete. When you bring it to the mouth, you'll see that with a little compression, to continue to merge between the provisional and the provisional abutment and help to squeeze and guide the papilla, close the embrasures. At this stage, we're ready to go back to finalize the lecture on the custom impression coping.